this computer. All right, now we're recording. Cool. And because we started late, we just did an introduction. But everybody right now is just answering this question, what is gender? And we're not going to dive into that right now.
Just kind of stimulate the conversation, get you all thinking about what that definition
exactly
means.
Yep, we're going to circle back to that. I'm reading the chat.
Yeah, me too. It's right here. You see? Okay.
Common words that come up are identity. We should have done like a word
and
chat
identify
bubble thing. That would have been identify.
Oh, yeah.
We'll have to throw that in. Tyra to use the poll everywhere in her public speaking talk. And
So
people would type in words, and then depending on the amount of words that were similar, the words in the, what was it called? The word bubble?
Word cloud?
Word cloud. Thank you. I said bubble. That didn't make any sense.
Oh, you're in the right. You know, relational frames.
Okay, yeah. Social construct. We're seeing that. Expression, self, identity. What else do you see?
Separate from biological sex, cultural identifier, social construct.
Cool.
Expression.
Excellent. So again, we're going to put a pin in that, and we're going to come back to that.
Okay.
Perfect. Maybe. There we go. So I want to take a brief moment to talk about privilege and perspective. Oftentimes when we have conversations or presentations or we talk about topics that can, I don't want to say controversial, but can challenge people's perspectives. Oftentimes presenters or people that are of a certain identity or a certain group, they're going to have a different perspective on something, and a different perspective than you may have on a certain situation or concept or anything. And what did I say earlier today? And you wrote it down. It's in our notes.
Privilege is comfort with the way things are.
Right. So if you have moved about your life relatively comfortable in who you are,
in the rules of society,
and how society is structured, you can associate that with a level of privilege. I have privilege. Everybody has some, in some way, shape, or form. Most everyone has some sort of privilege. Some people have more than others. But I want to point out that when you hear somebody speak in a vulnerable way, or might be talking about something that's hard for them to talk about, that may be expressing things that they've struggled with in the past, you might see that as being brave and inspiring, and that's all well and good, and that's great. But just know that that's hard for that person potentially. And if you've ever been, let's hang on, if I go to the next slide here. So there are all these movements, right? So we've seen the Me Too movement, Black Lives Matter, Trans People Belong, which is kind of cool because that exact poster is the one that's right back here. Not that one specifically, but it's all from the same protest that we went to. And so when you see people that are coming, that are in a part of these movements, that have had these experiences, that's hard. And just acknowledge that in order to teach you about an experience, or to have you understand and to gain perspective, oftentimes they have to talk about stuff that's hard and vulnerable. So if you've ever gone to like a privilege walk, privilege walks are to teach people about their own privilege. But in order to do that, there have to be people present that are in the back that don't have privilege. And just think about, yes, you're learning. You're like, wow, this is a visual representation that I have privilege. That's great. That's also another reminder to that person that they, again, don't have privilege, and that they are still stuck in the back. And it's just reiterated over and over and over again. And so just keep in mind that when you're hearing stories and thinking, about that if you find yourself feeling uncomfortable or not understanding something, just that's an opportunity for you to learn and to listen. And we're going to talk about cultural humility in a second. Do you have anything to add to that?
No.
I kind of just rambled on.
I have something to add, but I'll wait until we get to the next slide on privilege.
Okay.
Yeah.
Is that the next slide? Yes.
Yeah.
So and the word privilege too is starting to take this, at least in my opinion, starting to take this function of where people will get defensive. And we want to talk about that in a behavior analytic perspective.
Well, privilege isn't about guilt. It's not about shaming. It's not a process to ridicule anyone. And it's also not about being grateful, which is how I used to understand it. Like, yes, I'm very grateful for my privilege. And that was kind of the stopping point for me because I didn't understand what it meant beyond that. But it's the purpose of recognizing when you have privilege is to be able to figure out ways that you can use that to better everybody's access to reinforcers so that everyone has privilege. Everyone deserves to have that.
Right.
So I always try to just emphasize that it's not about feeling guilty or grateful or anything like that. It's just recognizing differences and experiences and recognizing that we all have a part to make things better.
Yeah, and power and privilege, if you think about those concepts, if you have power and you have privilege, you have access to and control of reinforcers. And in a sense, control of reinforcers that could be allocated to somebody else as well too. So just acknowledge that, for one thing, that most of you may work with individuals on the autism spectrum. Even you as a behavior analyst walking into somebody's home, you have power over the individuals that you're working with. You have access and control of their potential reinforcers, which could be treatment. You can write a report. You can write a report in such a way where you're not going to provide services anymore. That's power. That's, again, I don't want to paint it as this negative or positive thing. It just is, and it's important to acknowledge that.
Right. With power comes responsibility.
Exactly.
Right?
So thinking about, we're going to talk about present moment awareness. We're going to talk about developing self-awareness a little bit towards the end. But understanding yourself, for one thing, there's a lot of research that I've been reading lately where it's talking about like self-monitoring your own behavior and understanding yourself. And understanding yourself almost serves as a motivating operation to learn about other people. So just consider that as we're working through some of this. That you can develop some of that present moment awareness through your own identity work and understanding your power and your privilege in certain situations. So we're going to talk about a scenario real fast. Okay. Here, let me move this for you.
Thanks.
You're welcome.
All right, so here's an example. Shannon and Dimitri are friends and colleagues. Shannon's transgender and has been working to advocate for more inclusive practices within their organization. Recently, the organization changed their bathroom signs to say all gender, a change that Shannon had been asking for. And during a conversation with Dimitri about the recent change, Shannon expressed frustration with the organization's continued use of male-female gender markers on paperwork. In response, Dimitri commented, "But look at the progress, though."
And so that seems great, right? That response.
It seems harmless,
right?
If you don't have that Shannon's experience.
Right. This is where perspective is really important in listening to people. So thinking about that phrase right there, look at the progress though. Yes, look at the progress though, but somebody's also communicating something that's still really hard for them based on their identity. So thinking that could potentially be harmful, what do you all think would have been a better response that Dimitri could have given in that moment? Put that in the chat box. There's no right or wrong. Don't worry about your language. Don't worry about anything like that.
Just want to see what you all think about that. Okay, so something validating, like that's frustrating. We still have work to do. You're right, let's work on that. We should update the forms. There you go, empathize and validate. Something that doesn't shut down the conversation. Because look at the progress though, it's like an immediate like, whoosh, there's not.
And it doesn't seem like it would, maybe from his perspective or somebody who isn't experiencing that. And I mean, I actually had this exact experience at a conference where I had advocated to get pronoun stickers. And what had happened was the conference didn't have enough to go around. So it just wasn't happening in the way that it was supposed to. And I had expressed frustration to a fellow behavior analyst, and they had said, yeah, but this is great progress that they even had them there. And so what that does in that moment is it shuts that down. you can't say, I didn't have anything to say back to that would have not communicated frustration and sadness and defeat in that moment. And so again, it's perspective taking, and that kind of leads us into this a really important conversation and topic, an idea called cultural humility. Do you want to give the definition of cultural humility?
Oh gosh, I don't have it recited, but cultural humility is a standpoint whenever you're interacting with people or situations that you're not familiar with. Maybe someone that's very different, has a different experience than yourself, and being able to approach that situation and that person with the standpoint that they are their own expert on their own situation, and to take the stance of a learner and a commitment to understand more and not to assume that you already know. Like, for example, I have a bit of experience these days interacting with people that identify as transgender, but that does not make me an expert on people that are transgender. And it doesn't mean that I could meet somebody new and immediately assume that I know their experience, based on my own personal experiences. I would need to know that they are an expert and approach them as if I don't know, just assuming that.
Yeah, so right, it's the learner, like taking a learner stance. When you come into contact with anything, you are there to learn. You're not there to act like you know somebody else's experience. Even somebody, it doesn't matter if they're outside of your social cultural identity or within your group or not. I even had an experience just recently where I'd posted something on social media about just respectful behavior when listing your pronouns in like a registration form, and somebody had come back and they were like, but this is my perspective on that, and they were a part of the same community that I'm in. And it was hard for me in that moment to sit and to say, okay, like I can see, like my question then was like, okay, then how do we fix that? How do we change the language on our form? What do we do in that moment? So it's not other trans people, can have different perspectives and different experiences as well too. And the issue is if you're coming at it from a standpoint of cultural competency, which is what our field really talks about, you're coming at it from, okay, this group needs this, and this, or this group has this, and experience. And it's very finite, right?
Like a checklist.
Right. Hence the icon that I chose to put in the PowerPoint.
Good work.
Right. So when we talk about cultural competency, this is something we talk about. It's in the word competency is used in our ethics code, which we're going to talk about in just a second. But it's something that is very common language when we're talking about developing skills of working with people other than ourselves. We talk about, okay, building cultural competency, and that's great. But that word competency, especially for behavior analysts, almost goes to like mastery. Like you can kind of put those into like, I've mastered this skill set, or I have this knowledge. But when we compare that or contrast that with the idea of cultural humility, we can learn certain things, but we're always learning. And so regardless of who we're talking to, if we have a lot of experience working with somebody, I mean, how many people, if you all work with individuals on the autism spectrum, how many of those individuals are the exact same and have the exact experiences and the exact needs and the exact strengths? None. I worked with a parent one time that was a huge advocate, and she said, when you've met one person with autism, you've met one person with autism. It's the same for anybody. And so if you take this stance of cultural humility, you are putting yourself in that perspective of listening rather than teaching or saying that I don't know. Do you have anything to add?
No.
I get long-winded on that section.
You hit the nail right on the head.
Okay, cool. You talk about the ethics code.
Okay, so there are several codes that this applies to. I've got them listed on our notes here, and I can just ramble them off real quick, the ones that are directly related. 1.01, 1.02, 1.04, 1.05, 2.0, 2.02, 2.05, 2.09, and 9.02. This content that we're talking about here about affirming practices and inclusive behaviors applies, and we are responsible as behavior analysts to know this information and to learn this information, because as Arin could talk a whole lot more about than I can, individuals with an autism spectrum disorder are more likely to also experience some sort of gender identity or gender variance that might be different from what their parents expect, what society expects. And so if you have not already come across that, then it's highly likely that you will. We could go into a whole talk on different scenarios and how the ethics code applies, but for the sake of time, this is only an hour.
Yeah, the one where it really shows up is 1.05C, where it talks about differences of age, gender, race, culture, ethnicity, all of that. The issue with that sometimes is that when people hear the word gender, it automatically goes to male and female.
Sex.
And so so the conversation of individuals who might be non-binary or gender expansive or gender variant, whatever terminology you want to use, really gets left out of that conversation and really gets left out of the protection of ethics codes or federal laws or anything like that. But these are just a couple that we've referred to constantly, and making sure that you're practicing in your scope of competence, and then not engaging knowingly or unknowingly in discriminatory acts in any way, shape, or form.
Right. And I think here a discussion on our number one principle, not to do harm, is really important, because if you don't know better and a parent were to come along and say, you know, I had this happen to me actually before I knew better. They had a child who was expressing really significant, only 3 years old, but really some pretty outward and obvious statements that something was going on in terms of their identity. And obviously there were no treatment goals or anything like that to change that, but that was presented, and I had an opportunity there, had I known better and been competent to deal with that, or had contacts that I could reach out to help support me in providing services. I could have reduced the likelihood of harm in the way that I treated that individual, the types of toys that I provided as reinforcers, the type of language that I was using. I could have also provided information to this child's parents to help them understand what the risks were that for that child. So it's just, I want to make a statement about the potential of doing harm by accident. And if you don't know better and you are faced with a situation clinically or in your professional life elsewhere, just make sure that you reach out and you get clinical support so that you minimize the chance of harm.
And I know that's hard to know if you're coming into a situation with this knowledge, which you think is true, right? It can be hard. So if you have not been taught anything else about gender outside of what you were potentially raised, and so you enter into a situation and not knowing that you could be doing harm, it's really, really challenging situation to be like, wow, I didn't know. Mm-hmm. And so I think there's a larger conversation that obviously goes outside the scope of this presentation in the only 32 minutes that we have left, time check. But is how we are making sure, and I think making sure that we are competent, but I think it really goes back to that cultural humility and listening to what they're saying and being able to tap into that moment when they're saying, my kid's expressing this, this, and this, and you saying in that moment, could it be linked to something with that? I need to get more information. Who do I go to find that? Instead of relying on your pre-existing knowledge, right? Exactly.
Yeah, your background.
Okay, so here's where we're going to circle back to this conversation that we had in the entry ticket where we talked about what is gender. You all gave a lot of things that we're going to talk about, so you're ahead of the game in comparison to what I would say a majority of society really understands about gender. So first of all, gender is a human creation. This is not something biological. This is not something that, I don't know, it is something we have created. So we tend to, a lot of you are saying social constructs. So this is something that we are coming back to and we're saying is developed by humans and is constructed by society and by behavior and what is reinforced. We define it by roles, rules, stereotypes, we can all think, and we'll do a brief exercise with you all here in a moment that will kind of explain that. But again, thinking about social and cultural contingencies and what that looks like. The thing that people don't really know is that gender has always been expansive. It hasn't been until more recently in the human existence where like colonization of America and things like that really isolated people and reduced the amount of gender expression. If there's actually on PBS's website, there's actually a map where you can go and you can click and look historically at different tribes and groups of people who have celebrated the expansiveness of gender throughout history. And so we have now come and colonized America and put people into these boxes, and we have to fit these certain standards. Again, all of that discussion is kind of out of the scope of this short presentation as well too. But because of things that have happened, we now live in this current binary system, right? We have women and men, and that is what we're taught is gender. But if we look historically, it is much, much broader than that. So how do we get where we are? And that's
right. And this goes back kind of what we were talking about with coming into situations with your own knowledge. Really what we're talking about is your own gender training. And we've all experienced gender training. Where we go?
Sorry.
That's okay.
Yeah.
So it starts very early, right? We're taught based on the physical sex. Is there a vulva? Is there a penis? And that gender expectation starts right there, and it continues on throughout a person's life, and it's shaped throughout our history, and it's shaped by the cultural norms and rules and the reinforcers that are available to us for conforming to
right
that.
Exactly. And so if you think about gender being self-identified, it's interesting that we're selecting somebody's gender before they're even born, right? What did you call these? Physical, what'd you call this?
A physical genitalia reveal
party or something like that is essentially what is happening. Yeah, genital reveal, perfectly, something like that. And even that we'll get into just briefly is not even accurate either. So, but as you all have seen, thinking about things that are highly reinforced and the attention that is given and the acceptance that people get by engaging in this one down here in the bottom right, all the people with their cameras out and jumping around, and you think about how that is reinforced in the contingencies associated with slamming some weights and blue powder coming out.
Imagine too, that's supposed to be a boy, if that boy grows up and there's so much emphasis already on the penis. Right, exactly.
So
stay consistent.
But these things are trained into us, these norms, stereotypes. So there are ways that we're going to do a little exercise with you all. But I want to talk about gender and gender training, gender stereotypes from an RFT perspective. So relational frame theory and the people working within that have been able to do some research. I don't know if you've ever heard of Project Implicit. That's a little bit different, but there's also, there's Project Implicit where you can test your implicit bias. And then there's IRAP, which is another kind of implicit association test that deals more with relational frames. Again, we're not going to get into all that, but essentially what we're saying is that these messages that were sent, the behaviors that are reinforced, the models that we see, all go in to build these relational networks that we have. And so we have implicit attitudes and we have explicit attitudes. Implicit are immediate thought. So if I was to flash a picture of a Middle Eastern person on the screen, your immediate, probably implicit attitude reaction that would go to that would be something associated with terrorism, because of the amount of media attention and messages that are sent that that person on that picture might not be a terrorist, but that could be your first thought, that they're dangerous, they're unsafe, that they're going to hurt somebody, right? However, you may have these explicit attitudes where you know and you don't want to be that. I'm not a racist. I can think this. I can separate those two things out. So your implicit attitude and thought, that immediate reaction might be different than your explicit immediate reaction. So I'm going to throw some words on the screen here. And I want you to try to pay attention to that immediate thought of where you would put this. Would you put it with a boy or with a girl? Or would you put it with a man or a woman? And these are attributes or characteristics or just words that would be associated with one gender or the other. So just in your head, I'll read it out loud. You don't have to write anything down, but just say out loud or think to yourself which one you would associate this with. So gardening, traveling for work, home with the kids, pants, blue, cooking, assistant, agreeable, strong, bow ties. Okay, so what I'm gonna do on the next, oh, pink, sorry. I had one more. Thought I had them all. Okay, oh, I thought I cut that list down. My bad, I promise. One more, boss, my fault. Okay, so the next screen, we took those. If I was to put you into a simulation where it's going to measure response latency to pick one of these, and the relations as to whether that would be like congruent or incongruent. So if you think about boys go with blue and girls go with pink, if I was to put you in a situation where you had to match girls with blue and boys with pink, your response latency would be longer, ideally, because you've been taught that boys are blue and girls are pink from the day you left the hospital, probably, with the little hat on your head. So again, you might say, okay, I know tons of men that wear pink and that's great. And I'm sitting here, Kristen's wearing pants right now. And I know a lot of strong women, that's great. But that implicit response is going, like your response latency to match those two would be smaller or shorter in duration for those things that are implicit, that the messages that we've been taught. So in the chat box, how many of you, for the most part, were consistent with these? We know that that's not always the case. But I'm just wondering if these, like, obviously males being the one on the left and females being the one on the right. It'd be interesting to know if there was some consistency with those.
Yes. Okay.
Yeah, and there might be some that go one way and the other too, right? Or you might have been sitting in the moment going, well, I don't know about this, which is fine. Again, if we were, this is the way that we have to measure this, just through Zoom. But if we were to put you in a test to measure your response latency, even just the smallest, you'd probably be able to tease out a lot more differences when you had to make those selections. So it's just thinking about implicit bias, implicit responses. Again, it goes back to, how you perceive things and those thoughts that might show up. This is where we're talking about self-awareness and paying attention to, okay, what is my implicit thought when I hear the word transgender, or if I hear the word non-binary, or I hear LGBTQIA. Like, most of us have been taught that that's not okay, that there's some level of that it was in the DSM. Like, right. I could have had a mental health diagnosis, up until 2 years ago, according to World Health Organization. Mm-hmm. And so when those are the messages that are sent, whether you want to or not, whether I know you and you love me and I love you, the messages that are in our head can be a little different. Ashley, no, I haven't done research on that. However, I have written a paper on it and I have a proposal ready to do something like that. So hopefully, maybe next year this time, that would be cool. But, yeah, cool. Okay. So let's talk about gender and what that is just briefly. I know we only have 20 minutes left and we really want to get to, the end of, in terms of like committed actions and fostering inclusion. So we'll just breeze through some of this stuff, but gender, we're talking about self-selection. There are lots of different dimensions. So thinking about your body, the parts of your body, how you express yourself, gender expression, and then your identity. Thinking about bringing all of those into alignment. And for most of us, most of you, there's been some part of where you might have had to bring that into alignment, whether it's gender expression or coming to terms with identity. But for a lot of people, that's already there. It feels
Right.
natural. That's not the case for everybody. And so part of that transition word that you hear is not necessarily a transition. It's this journey of bringing all these three things into alignment. And sometimes that never happens. Sometimes it might take longer.
Or more like intensive measures.
Right.
To do that.
Exactly. You talk. So I did switch this around. Gabriella, if you're here, you can tell your sister that I switched this because she's the one that taught me about.
Gabriella's here.
I know. SGM stands for sexual and gender minorities. It's a little bit more inclusive and encompassing. There's a lot of language associated with the LGBTQIA. There's a plus at the end, which is supposed to encompass the rest. But again, this, I actually like this term better. So
yeah, it's broader and more inclusive. Yeah.
So we're going to throw some words up on the screen, and then Kristen's going to talk about those. Again, this is just a sample.
Yeah, this is just language, and it's not all the language that's out there, not even close. So this first group over here refers to somebody's sexual identity. Sexual orientation. So obviously we all understand what straight, gay means, bisexual, asexual. It, for those that don't know, refers to someone that doesn't have
Sexual.
Yeah, I really don't know because I'm not asexual, and so I hate speaking for groups of people, but basically it's a lack of sexual relationship. Or maybe lack of desire for sexual relationship. And then pansexual is actually how I identify, and that is your sexual orientation doesn't depend on a specific gender or any. It doesn't matter. That's just not an important variable.
You love everybody.
I'm a lover of all the people. Okay, Jen, thank you. It refers to not having sexual attraction. Perfect. Appreciate you.
And correct me if I'm wrong, but that's different than romantic attraction. Like you can have romantic attraction or emotional attraction to somebody else. It's the sexual attraction part that is different.
Specific. Yeah. And then there's gender identity, and these are some overarching umbrella terms. Cisgender would be somebody like myself, where my sex assigned at birth is consistent with my gender expression and my gender identity and how I see myself, which would be as a woman, and as a female if we're referring to physical sex. And non-binary, I'm going to let you talk about non-binary.
It's just non-binary kind of fun. I don't know. This is where it gets tricky because some of these words mean different things to different people. I just really had these up here just to essentially you identify outside the binary system that we have. Transgender means that you deviate away from the cisgender. So it's trans. It's beyond what you were assigned at birth. This is where it gets tricky. Is like you don't want to tell somebody how they identify. I had somebody tell me one time that they said, I know you identify as non-binary and not transgender, so I don't know if you'd be able to answer this question. And I was like, oh, well, actually I identify as both because they're both terms that feel congruent with me. And so, but that's where I'm saying don't tell somebody how they identify. And I know that's language and it gets tricky, but
and there's physical sex, which is where the penis and the vulva come in, and the genital reveal parties come in, and that is designated female, male, or intersex. Intersex isn't always physical. There are lots of individuals who are intersex and they don't know it because you cannot tell from the anatomy that you can see, but at a chromosomal level or a hormone level or a secondary sex organ level, there might be some variation there.
There's also an identity part too that comes with this. I've talked to people who identify as transgender and they were female at birth and they now identify as male, but their body has not met up with what they want it to be, and so they still identify as male, and it just gets into a lot of complexity. And this is where it's important just to listen and take somebody's experience without trying to make sense of it all. You're not going to make sense of it all, I assure you. But it's just to take that and to listen. And if you are feeling uncomfortable, then that's something you need to deal with. It's not that person's job to make you feel comfortable. Their source of comfort should not be their concern. And so we'll talk about education and all that stuff in a second, because we have 15 minutes left. Gender identity, what we had on the title of our presentation, is essentially this internal feeling of who you are. And I know that's very subjective, and it's hard to identify exactly what that is. But if most of you are sitting there saying, do I feel female? Do I feel like a woman? Do I feel like a man? And most of you are saying, yeah, like, cool, that's good. That's fine.
Right.
But when some people ask themselves their question, they're like, no, absolutely not. I don't feel like that. I don't meet all of these roles that society has set up as to what women are. I don't express myself that way. I don't know. It's just, it is this internal feeling of who you are. If you go search list of terminology for gender identity, you're going to come up with a very long list. What we just provided was minimal at best.
Right. For the sake of space and time and everything, but there are a lot more. Ashley, I saw your question too about not including queer in the sexual orientation box. Just space and time.
Yeah, exactly. There are a whole ton of words that we can use to identify in terms of sexual orientation or gender or any of that.
Yeah, and I think it's really important just to make very clear that this is somebody self-selected. This isn't like, I wouldn't come and assume somebody's gender identity or their physical sex or any of those dimensions, sexual orientation either, based on what I see. That's up to the individual to determine.
So we're going to get into talking about minority stress and things like that, but I think it's really important to talk about acceptance or rejection.
Mm-hmm. Yeah, so we haven't talked about minority stress yet, but there is quite a bit of research that individuals who identify outside of social norms, and they very frequently run into discrimination and prejudice and fear and situations that are scary. Maybe they have to hide who they are. There are lots of things that contribute to detrimental outcomes for that person and groups of people. And what we know is that social acceptance is really critical to a person's well-being. That's all of us, but particularly with this group, when it comes to resiliency, there's an extra layer of resiliency required to get through, and family acceptance and social acceptance in general makes a huge difference, but it does not make any difference at all as to whether or not an individual identifies as transgender or cisgender or gender nonconforming. So there's significant research showing that it doesn't matter if you raise your child to grow up as a male or a female, their gender identity is going to be unique to them. But it does matter how accepting the family is if it is different than what they're expecting.
So essentially you can have a happy or not happy kid that will still be who they're going to be. It doesn't matter. What matters is their well-being, right?
Yep. I have a 17-year-old who came out with some questions and things like that. First started talking about gender identity at 15, and they do identify as transgender. And anytime I've had a conversation with somebody and they're like, oh, that must be so hard. Like, no, it's not hard, because it's really simple when you look at the research. So I could have a dead daughter or an alive and well son, and I'll take that alive and well son all day long.
And he's still the same person
that
he was before.
Nothing changed except for the language.
It's important to talk about social validity, social significance of all of this. And so if we think about going back to that notion of do no harm and how that is one of our core ethical principles that we have to follow, we can talk about the idea of minority stress. So we all deal with stress, but there's an added level of stress that minorities deal with. And so if you think of any minority, It doesn't matter. We're just talking in the context of those who are gender minorities. So what happens is that when you have minority stress and heightened levels of that, that can lead to increased mental health problems such as anxiety, depression, even suicidality, and then high risk behaviors associated too. I think there's higher levels of addiction. I don't know, what are some of those high risk behaviors?
Sexual behaviors, suicide, lots of things. And it wasn't until 2016 that there was a study done on a group of children who were cisgender and a group of children who were transgender, and they were comparing their mental health outcomes, because in the past it's always kind of been conceptualized like there are mental health problems with people that are transgender, and we now understand that it is the environment that creates the context for those mental health problems. But in this study, they looked at a group of children that were transgender, and they were affirmed, meaning they dressed the way they wanted, they wore their hair, the names and pronouns and everything matched their gender identity. And for the first time, that study showed that those group of children did not differ between cisgender and transgender on their levels of anxiety and depression. So just making the point that environment matters.
So there are some factors that go into that, not only family acceptance or rejection, but just overall years of prejudice and discrimination, rejection by social environments, whether that's intentional or unintentional, physical, verbal, sexual harassment, lack of quality access to healthcare or access to quality healthcare. And I want to just say quality, like we can have access to quality, but more like affirming healthcare. So if I go into a doctor, are they going to listen to me when I tell them what's going on with me? Are they going to agree to give me hormone therapy? Or are they going to tell me that I need to go have a psych eval done prior to that? You know, what are the laws, inequitable laws that are set up to make people feel more inferior than others? So there was a U.S. A survey that was done in 2015 of transgender individuals in the U.S. And we've pulled a couple of those stats. It's very comprehensive. They're doing another one in 2020, so now. But we're just going to breeze through a couple of these just to lay the groundwork to show, you know, some of these things that people experience. So 46% experienced verbal harassment because of being transgender. A lot of you may have experienced that too, but think about that being directly related to who you are and who you've chosen to be. That's a very high percentage of that. The unemployment rate is 3 times higher for the trans population than the US population. Those are backwards, the unemployment rate. The 15% is for trans population. 5% is the national, when this survey was done for the US population. So 3 times higher unemployment rate, roughly that same for living in poverty.
Makes sense.
Makes sense, exactly. 16% of respondents reported losing their job because of their gender identity or expression. 77% took steps to avoid mistreatment. So they might hide who they actually are. They might delay any sort of like gender transition that they want to go through. They may quit their job. And it's important to note there's no actual legal protections around that. There's Title VII, which you know, is going through Supreme Court decisions right now to see if gender actually covers transgender or sexual orientation, like all of those. Is that covered under Title VII? So right now I could be fired because of who I am if my employer does not like that. There's this big conversation about bathrooms all the time, and it's like, oh, it's just about bathrooms, or it's just about pronouns, and it doesn't seem that big. But when you've had to stand outside of a bathroom and decide if you're going to go in or if you're not going to go, or where you're going to go, think about the stress that's associated with that, because when you walk into a bathroom, it could be dangerous, or that you might experience verbal harassment or something. So again, it's not just bathrooms, because 32% of people that respond to this actually limited the amount that they ate or drank to avoid using the restroom, and 8% actually had kidney infections or some sort of like UTI because they avoided restrooms completely. So when we're talking about social validity of restrooms, yes, that's important, because we have people not going to the bathroom and having medical conditions due to safety issues surrounding that. Okay, so we've got like 5 minutes. Oh, we always do this. There's so much to talk about. Okay, so we just want to, I don't want to breeze through any of this, but we do want to talk about, again, as fast as possible. Why is this not moving forward? some actions to foster this. And the first thing is identifying values. You're my ACT person, so you're going to talk about identifying values.
Yeah, identify what's important to you. Is it important to treat everyone with kindness? Is it important to be respectful? Is it important to create a better world for our children and for our friends and our loved ones? And if it is, then let that guide you and to changing some of these behaviors that we're going to talk about.
And that might be incongruent with people in your lives and what they believe.
Yep.
So shifting your language. So make sure that if you are meeting somebody that you're going to provide your pronouns at your introduction. Tell people, and it's not to out yourself. It doesn't matter what you choose or what you select. You can just say my name, but tell people how you want to be referred to. And that's not just for you. You may think that it's easy. It's also to create an environment that is affirming to anybody else who might be in it. If somebody does not give their pronouns or you don't know how to refer to them, use gender neutral pronouns until somebody self-identifies their gender. Make sure that you use their name and their pronouns or language that they want to be used without question. Continue to use gender neutral language. That's just not pronouns. The amount of times that I get called like ma'am or somebody says ladies or something like that is I should count one day and take some frequency data on what that looks like. And then I always challenge people to, when I say binary honorifics, I'm talking about yes ma'am, no sir, all of those things. And I know that that is a source of respect in a lot of cultures, especially coming from Southern culture and Southern family. Like I know I was taught to say that. I taught my kids to say that. And now having to like backtrack on all of that. And yes, you're saying it's for a sign of respect. And we'll say this, don't go through these real quick. Don't assume gender based on appearance. Don't ask or suggest to use different pronouns. Don't allow rule-governed behavior with cultural norms to take priority over human dignity. That might be one of my favorite statements in this entire PowerPoint that we have is, if you're saying that you're doing something out of respect, is that your culture that's dictating that respect, or is that person who you are showing respect to? Because respect is different depending on who you're talking to. So it needs to be, that respect is within that context of that person. So just consider that, please. Yeah. You want to talk about this?
Educate yourself, take on that perspective of cultural humility and a lifelong learner. Take a look at your privilege, even if it's uncomfortable and hard and it brings up hard feelings. There's usually information there if you're willing to allow that to be there. Research your own questions. If you leave this presentation and you're curious about something, don't come to Arin and be like, well, this one non-binary person, I have this question, post your presentation. What do you think about this, that, and the other? Don't do that. Everyone would do that, and I'm sure it's exhausting a little bit, and it's not very respectful or sensitive to that person's experience. So research your own question and show that you've done your research if you do have a question for somebody, maybe is in a specific group. So don't be lazy about it. And then work on building fluency. If you are new to using gender neutral language, which I still am learning, work with a friend, work in your own private covert behavior.
We're behavior analysts. We know how to change. I've had so many people say, but I've got this extensive learning history and I can't change that. I call BS on that. Like, yes, you can. We change behavior for a living, and it's possible if you want to put in the work. And that's where it attaches back to that value.
Habit reversal. Check it out. Ask a friend or a coworker to point out mistakes. So I often tell people when they're coming to visit us or whatnot, if the opportunity is available and I feel safe to do it, I'll say, hey, are you okay if I, point out to you if you misgender Arin or whoever else is there? And the purpose there is to recruit somebody to help you out. I know. I need that though. It's closer. Okay. And then, of course, learn appropriate error correction procedures so that you're not over apologizing and making a really uncomfortable situation for the person if you do misgender. An elaborate apology just usually is not a good idea.
No, it's not. And you think about if you were to misgender anybody else, would you make this big, long apology? And you wouldn't. You would just self-correct and you would move on. To not draw attention to those things is great, because I would go into detail as to what that feels like when that happens and the internal response and, respondent conditioning and all that stuff. Again, we only have like 2 minutes left, but
yes, and there's an article, Edith asked about resources if you want to learn more skills and behaviors to create an inclusive environment. There's an article, 2019 article by some friends of ours, actually, with a self-assessment that you can
we'll send it out.
use, and we'll send it
There's
out.
some great websites too I can link to. So, but just to finish up here, brace culture humility. So just listen to people, you know, when they're telling you their experience, or just like in that example that we saw before, just listen to them. You don't have to make them feel better or something like that. You can just validate. You can come to learn and not to teach. Just because you have a friend who's trans or gay or something doesn't mean that you know it. You can just come to learn from that person's experience. Behavior change is going to be uncomfortable. Accept that discomfort, like sit in that, know it's going to be hard. Don't avoid that or try to escape it.
Maybe relate to it as an opportunity, you know, when that discomfort does show up, rather than avoiding that. Get curious about it and say, like, well, what is this telling me?
Right. Respect the experience of other people. Again, you don't have to understand it. Respect their privacy too. Like if somebody tells you something, that does not mean you get to go tell anybody else. Consider that, like, if somebody tells you something, consider that to be a vault. It is not your story to tell. You don't ever speak about my experience. Anything that you say about Elliot, your son,
I went to Elliot about 30 minutes before this presentation and said, hey, we're doing this presentation on this topic. Are you okay with me talking about you?
Right. You know. And then just know that inclusivity is reflected in your behavior, not your ideas or political views. So if you're coming and you're saying, I'm liberal, but this, and this, or I am a Democrat, so I'm all on board, that means nothing to me. It is your behavior that is followed, you know, so if you're saying that you're liberal and that you are even a part of the LGBTQ community, that, and then going and spouting off a lot of other stuff over here, that again, that means nothing. So I don't know. I know we're like a minute over. Final thoughts. I mean, do you all have any questions? Kristen always likes to include this quote, and I love it too. It says, I've learned that people will forget what you've said, people will forget what you did, but people will never forget how you made them feel. And I think if I think about experiences that I've had with people, and I think you've communicated the same thing, that emotional response that shows up is absolutely what sustains.
Yeah, and I think for me, it's just the takeaway message that you have a power. Each and every one of us has power, and we have power to do good and to help people, or we have the power to hurt, even unintentionally.
Thank you all so much. We'll send out, we've got the references, we'll send out this PowerPoint too. And then a bunch of the things that we linked to. I'll also send out the Google form where you all can get your CE credit for this.
Yeah, we'll send out a bunch of resources.
And then we're going to post the recording, which I'm going to stop recording here. We're going to post that on the website so you can use this. Also too, like if you all come across clients or anything like that, don't think that this training is enough. Make sure that you consult with somebody. I think that's absolutely critical.
Yeah, this is not meant for establishing competency at all. So it's just a primer and onto the topic.
All right, everybody. Thank you so much. Reach out to us with any questions. And then, yeah, we'll see you all on like Facebook or something like that.
Take care, everybody. Enjoy your day and your weekend.